When we talk about an ideal female body shape, an hourglass figure always comes to our mind. This is a shape which in right proportion enhances every aspect of a female body form and give it a pleasing, attractive look. Due to the current media trends and internet trends, this kind of a hourglass figure is becoming more and more desirable among females. Hello friends, I'm Dr. Diksha Dixit, a cosmetic plastic surgeon Delhi based at GK1, and today we will talk about an hourglass figure, how to achieve it and how an expert plastic surgeon can help you achieve the same. Before discussing about an hourglass figure, let us first see what kind of body shapes or female body forms are there. All these body forms differ according to the age, ethnicity and the cultural background of the female. The first figure or the body shape is an apple-shaped body shape, in which the shoulders are rounded, the bust is average and fuller, and the middle section of the female, chiefly the abdomen, is fuller and bulging. The second is a pear-shaped figure, in which the shoulders are narrow and the bust is small. You have a defined waistline and the buttocks and the thigh region are fuller and thighs are bigger. The third figure is an hourglass figure, in which you have the upper and the lower part of your body are fuller and you have a waistline which is well defined. The fourth figure is an inverted V figure, in which the shoulders are broader, the upper part of your body is fuller than your lower part of the body, without any defined waistline. The fifth figure is a rectangular figure, in which the upper and the lower part of your body are in straight line and that you don't have a defined waistline. Now all these body forms also differ according to the age of the female. How does a female body form behave according to age? Usually in your teens and 20s, you have an hourglass figure on an average. As you age, in your 30s and 40s, you develop an apple-shaped figure. And as you age, either this apple-shaped figure remains or it usually becomes a rectangular figure because of the laxity of the skin and ptosis or drooping down of your body form. Now let us come to discuss what we always wanted to know is the hourglass figure. Chiefly defining an hourglass figure is you have each proportion of your body which are well defined. Now your upper part of your body and your lower part of the body are fuller, as in you have broad shoulders and a fuller defined bulging breast, and you have your bottoms are also well defined, round and fuller with a very defined narrow waistline. This shape makes every part of a female body form conspicuous and attractive, and it also enhances the overall appearance of the female. These body forms have smooth transition from one zone of your body to another. So that is why each part of your body is highlighted in a very pleasing and an attractive way. When a patient comes to us desirous of having an hourglass figure, there are two main important things which we look for. One is your waist to hip ratio. Ideally, if you go by the books, the ideal waist to hip ratio is 0.7. If you're wanting an hourglass figure, this ratio may vary because you would like to have a narrower waistline and a broader hip. The second is we look for the type of lower body frame a female has. Coming to this, we will describe first the different types of body forms which are usually seen in females. So lower body forms are chiefly of four main types. One is an A-shaped figure. A-shaped lower body frame is when you have a tilting A in your lower body, that is from the waist to hip you have a diverging line. The second form is your V-shaped form, in which from waist to the hip you have converging line. Third form is a square shape, that is from hip to waist. If you see from the side, you get a straight feel, that is a square lower body frame. And the round body frame, in which the waist is not well defined, it is rounded along with the hip, and the smooth transition between them is gone. So depending upon these lower body frames and your waist to hip ratio, we decide upon which type of operation or the procedure to be done on you so as to get you an hourglass appearance. Usually, an A-shaped lower body frame is considered to be an ideal for a female body and mimics more closely to an hourglass appearance. But even that A-shaped figure, we have to define more so as to give you an hourglass appearance. If we talk about an A-shaped figure which has a relatively narrower waist and a broader hip base so that you have diverging lines, we opt for plain liposuction, in which we can define your waistline more by liposuctioning your lower back, your sides, your flank region, so that you have a smooth transition from a narrower waist to a bulging buttocks and hip region. If we come to the other body form, especially the V-shaped body form, the straight or the square body form and the rounded body form, they have a discrepancy in that their waistline is increasingly ill-defined and there are no smooth transition from lower back to your buttock areas and from the back, and also from the side the definition from the waist to the hip area is gone. So in this case we have to opt for additional procedures apart from simple plain liposuction. In these we have to take out fat from your lower part of your back, your side regions, maybe the front part or some part of your hip region, and add fat or do fat grafting in those parts which we want to smoothen out or give a curve to. So mixture or a combination of liposuction along with fat transfer or fat grafting have to be opted in these kind of lower body frames to give you an hourglass appearance. This can be achieved under the guidance of an expert or skilled plastic surgeon who knows different type of body forms, who can help you opt your procedure, who can discuss with you what kind of procedure will best suit you to give you your desirable end result. A skilled cosmetic surgeon who is routinely performing such operations know what to see in your body to give you your result. He or she evaluates your lower body frames, your waist to hip ratio, and also see what kind of transitions he or she has to enhance or eliminate to give you that hourglass appearance. So it is very important to have a detailed in-person consultation with your expert plastic surgeon to know what kind of procedure you want to go ahead with, and he or she can help you proceed for the same. All female bodies are not the same, so one procedure may not fit all. It is the role of your expert cosmetic surgeon to tell you what will best suit you according to your age, your ethnicity, your culture background, and also your profession. So please take out time to visit your consultant and discuss in detail everything, clear your doubts, and go ahead with the procedure. Hope I could give you an overview about hourglass appearance and how it can be achieved in different types of females. If you have any further queries regarding this procedure or any other related cosmetic surgery procedures, please do feel free to write to us. You can also watch our YouTube channel for any further information about any kind of aesthetic surgery procedures. If you want us to elaborate more on certain procedures, you also can put in your remarks, write to us, WhatsApp us to the contact numbers given below, and follow our Instagram handle by the name of _Aesculpir for any further details. We would be very happy to help you. Thank you.